Hello, everyone. Today we have some very important guests. We have Alberto. He is a Chinese medicine doctor. And then we have Vienna, that is a board certified nurse practitioner. And they actually have a spa here in Miami, Florida called Relax Spa. For those of you who don't know, we are located in Miami. So we wanted to invite them over today. They own a medical spa. And we just wanted to get some feedback on them on, how the spa has come to be, what it is that they offer, and also some tips and tricks as to why medical estheticians should be coming to the ICS trade shows. So let's go ahead and begin with a little short introduction. I don't know who wants to go first, either Alberto or Vienna.
Ladies first.
Vienna.
Oh, that's a good one.
So Vienna, you can just introduce yourself a little bit and let people know what it is that you do.
Perfect. So,
And a bit about your background and how you got started.
okay, so as you said, I'm a board certified nurse practitioner. Dr. Al and I met a very long time ago. We both used to work for a dermatologist in the medical aesthetics field. And back then, I was a nurse. Actually, I think I was a nurse in school still. And you were doing massage therapy. And we started working for that doctor and got basically into the world of medical aesthetics. Everything, actually, we say this often, we have a lot, the experience that we gained there is kind of set the grounds for what we do now. So we met there, and we always said that if any one of us branched out on their own, that the other would follow and kind of do something together. Yeah.
It's my turn. Well, I'm Alberto. I have a PhD in Chinese medicine, and what I do is holistic medicine. So that's something that I'm passionate about it. It's not that I'm against conventional medicine, but I love combining both of them, trying to see if we can treat something like, for example, migraines with herbs and acupuncture instead of having something that is, like a really hard drug. So, like Vienna said, we met, and always we said that someday we're gonna open something together because we got it. It was a click when we met at that office. So I think in 2014 I left that office and I opened my own office right after I finished the acupuncture school. It was hard. It was a hard time because I didn't have a business experience at all. I was sitting there for hours. I actually got a very little room inside of a Pilates studio. I was sitting there 7 hours a day, Sunday through Saturdays, like just trying to know people. It worked out because little by little I started talking to people, doing acupuncture. Then we thought buying the first laser, and we bought the first lasers, and that made us like grow faster. And it was a big change to the practice.
Okay. We didn't meet through the Pilates studio, did we?
No.
No.
Actually, we met after I met your mom.
But where did you meet her?
At this office now.
At the office now. Yeah. I was
Because
trying
one
to
of
think.
her clients came to the office.
true.
But that was like the
That's-
studio that I worked at.
Yes,
but
I remember.
Yeah,
we
the
never-
Pilates.
No, you started working at Pilates studio right after I left that place.
Yeah, because I started working at the other studio, the one that when she moved.
The
The
new
new
one,
one,
the
the
new
new
one
one,
location.
yeah.
Okay.
The
Right
new
after
one.
I left that place.
Yeah.
So when did you guys start Relax Spa?
I started in 2014.
Okay, and
I
then when
always
did you
was the
guys
same.
come together and open your spa now?
Well, she started coming. She used to work for the hospital, for Bacti Hospital, and once a week or every 15 days, depending on her schedule, she was coming to the office, especially after we got the laser, and she was doing hair removals with the laser. The office started like growing and growing. We have more patients. We need more space, and we like I said, we have a very
just a
little
room.
room, a little room. It was very small, like just one table. At some point, we decided that we need to move on and get something bigger. So we found the space that we are now. So we came to this space. Now that we have 4 rooms, we have a lot of different machines, and everything when
It grows little
grows
by
little
little.
by little.
Yeah.
Yeah.
So in this spa, you guys are a medical spa, but you offer a lot of services. Can you talk a little bit about the services that you offer?
We offer a lot, yeah. In terms of lasers, we have pretty much like almost every technology out there available. We have, well, we love Candela and their lasers. We do lasers for hair removal, skin tightening, radio frequency devices for skin laxity or flaccid skin. There's one that we use for vaginal rejuvenation. Then we have another one that's a YAG laser, and that treats acne, rosacea, any kind of like imperfections on the skin. We have a frax laser through Candela as well. The fraction in the laser. We do tattoo removal. We treat cellulite.
It's like you
Yeah.
do everything.
What else?
Yeah.
Literally, there's
everything.
Yeah, because
Every
beside the
technology.
lasers, we also have machines that there are no lasers.
Right.
Yeah, of
Like
course.
the Endofierce, which is a great machine for cellulite, for body reshaping.
Fantastic, yeah.
Also, we have a cryotherapy machine that is not the one with the suction. So we do one that is called cryotic shock. That is a combination of heat and cold, but it treats localized fat. It helps with the skin tightening. So it does a little bit of the cellulite, even though we prefer the Endofierce for that, especially for that treatment. But it's really good for localized fat, for all those things.
And with the clientele that you have, especially here in Miami, what would you say is the top service that you guys offer?
Well, lately the popular one has been the RF microneedling, so radio frequency combined with microneedling, because everyone talks about that
So
technology.
she just became an esthetician, actually,
Yeah.
and
Oh, that's awesome.
she just
Congrats.
opened her own little studio. And
I do microneedling,
Yeah.
not RF microneedling, but
Yeah.
I've seen like what it does to the skin.
microneedling
It's
is
so
fantastic.
powerful.
Yeah. I mean, on microneedling alone, you get some really good collagen
I was even about to start
induction.
talking to both of you guys about that with my skin condition
Yeah.
to see if that's something that I
You don't
should
have a
do.
condition. You're just
I have a
just had a little
condition.
breakout. I act the same way. I get one pimple. And I'll tell him like, okay, I can't work today. I need to put myself on
worst- the
antibiotics.
worst
Like,
ending.
Yeah.
like I
Especially for
cannot
you guys,
show
the
my
people, oh my
face
God.
looking like
Yeah.
this.
Yeah, but for someone who never has acne, when
Yes,
you
I
have
understand
that,
you.
freak out. You're like, what is going on?
It is a real problem. I understand you.
It's a problem.
What's like your favorite machine to use? Like what's like the most impressive machine that you have?
So we get really good results with that one. I would say the RF microneedling for skin tightening, especially of like our elderly patients for loose flaccid skin. And it's a really popular now one now because of all the weight loss that everyone's doing, that everyone's having.
Yeah.
So with weight loss comes loose skin, and that is fantastic. We get really good results with that one.
I love that one, but also one of my favorites is the Hollywood carbon peel.
Yeah.
So it's a laser that even us guys love that machine because it doesn't hurt at all. But it's a combination of a laser with the carbon mask, and it does a very good exfoliation to the skin. But also it's stimulating collagen and elastin, especially when you are over 30, 35 years old. So it's very good for important for us. And also
fantastic
it
on
gives you a
acne.
very nice glow on the skin. So every time that we're doing that treatment, and you can see once the carbon mask start like peeling off, you can see the glow on the skin. So it's something that I always because if you go back into lasers always you have to do laser in very clean skin. And with this machine, they came out with this treatment that you apply a carbon mask that is this color, and then on top of that, you're doing a laser, and it does wonders for the skin.
Yeah.
Like
That's
it
a
shows
great
immediate
go-to.
results.
Immediate results and no
Exactly.
downtime.
Yeah. I've done it before.
Yeah.
It's really
Really?
nice. That's
Yeah.
the one that I was telling you that she was saying for me to get done next week.
Oh, okay.
Yeah.
Because the
And my
carbon
mom does it all the
has
time. A bunch of
bacteria
clients.
killing
Yeah.
properties. So the carbon works great on any
Yeah.
little breakout too.
Yeah.
Nice.
And with all the equipment that you guys have and that you've practiced, do you feel that there's specific equipment in 2025 that's gonna be like the new thing, or not really?
I do. So right now, I think CO2 is starting to be a little popular. Before, it could only be done like surgically, like under anesthesia. CO2 is like a complete resurfacing of the skin, kind of like very aggressive. And now companies are coming out with different types of CO2 that you can do outpatient. So it's not like as invasive. A lot of patients and clients are asking us about CO2 and what it can do for them. There's also improvements. I think every device that we have every so often, for example, Candela, updates the technology and the system so they get smarter, they get more effective and safe in terms of hyperpigmentation, like for melasma and dark spots, which are a little bit trickier to treat. They improve the machine. So there's always like something
new technologies
coming out with it,
yeah.
coming out. But the CO2 is a good one, I feel.
So you started it sounds like you started with the skin first, and then did you go into the injectables and the fillers and stuff like that? Because
Yes.
usually I notice like nurses will do the opposite. Like they'll start with the injectables and the fillers, but then they know nothing about the skin,
Mhm.
and then that's where they struggle.
Yeah.
What I think is really nice about you guys is that you know both. Like you skin first.
Skin first.
You put the skin first, right? And I think that's very important. So like, can you just talk about your education and how I'm very impressed, like how you have all these machines and know so much. So
when we met, we worked
Mhm.
at this office where we did a lot of these lasers. So as a nurse, I did them. I became an electrolysis before I was a nurse, before I became a nurse practitioner. So I learned how to use lasers. I was trained on the technology of the lasers. And Dr. Al did kind of the same. There are devices and machines out there that are not necessarily classified as lasers, but they have similar technologies. Radio frequency is one of them. And when we started working together, when we first met, like our foundation was skin. It was getting to know, we got to know skin conditions from the medical aesthetics perspective, not clinical. And I think that was always like the foundation. So when Dr. Al branched out on his own, we were scared of getting that first machine, but it was we put all our eggs in one basket because we really believed and knew lasers and the technology.
And also, if you
So-
think about it, lasers are energy and light. And if you go to the human body, we respond to energy. So we are energy, but also we respond to light. So that's why when, let's say, for the LED therapy, if you have acne, you can use the blue light because it affects the bacteria. If you have pigmentation, you can use the green light because it helps with that. Inflammation, the yellow light. Collagen and elastin, the red light. So it's proven that we respond to that. And the lasers is just that, energy and light.
yeah, it's all
Yeah.
frequency.
and your
Super
reaction
cool.
to that.
Yeah.
And I find it interesting that you both have, so you have like the science backed, well, it's all science backed, but it's just the holistic with the more like, what would you call it? Like contemporary or
Medical,
Modern.
medical
modern.
modern.
Yeah.
Like how do you guys fuse that together?
Well, we always, every time that we have a patient or a new patient, we always do a consultation. Not every patient that comes to the office, like the fillers, like the Botox, like the toxins, lately we have seen more patients that what they want something that was called skin boosters, that they don't give you volume, they actually they do hydrate, they give you hydration, they give you they plump the skin. And what we do is we always listen to what the patient's problems are or their concerns, what they are looking for, and based on that we will in that direction. Maybe this patient, because he doesn't like or she doesn't like the Botox or the toxins, we go into something more holistic. We can do actually facial acupuncture for skin laxity, for skin
There's
glow.
also the oxygen facial.
The oxygen
that you do.
facial that is completely like
Yeah.
non-invasive. It's
I've
just
done that one too.
oxygen.
That hydrates
I like
right
that one.
away.
Yeah.
It's hydration completely. Everything that you're using in that treatment is based on oxygen. If they need more, so we fuse it with the other part. So if they want a little bit the filler, so we can go to the other side. So we always, before anything, we always listen what the patient needs.
Yeah, it sounds
Yeah.
like you guys have like a big toolbox, and it's just like the patient comes, this is my problem, and then you're like, okay, we can use all these different tools to help you based on what they also believe in and what they want.
Yeah.
But you guys are also, I mean, me being a client of you guys, I've noticed, and of course, you guys have become family to me, but I've noticed a lot that when it comes to clients, you guys are very honest. So if a client comes in and says, hey, I want, this filler or this or that, you'll go to them and be like, hey, look, that's not going to work out for you.
Yeah.
You're being honest rather than just, let me take your money and let me do whatever it is that you're asking me to do. On the other hand, you're more of like, okay, yes, I understand your concern when it comes to this, but I feel like this might be a better option.
Yeah.
And here's why. You guys are a lot like that, which is good
Thank
because
you.
not a lot of, Spas
No,
are like
you
That's
know,
part of our goal, honestly.
Yeah.
I literally start every consultation that I do with a client with what bothers you?
Mhm.
Why are you here? What is your main concern? Because what I see when I look at you, it may not be what bothers you when you wake up
Exactly.
in the morning. So we start there, and then based on what their concern is,
Mhm.
then I'll think of what we can offer them, whether it be a laser or something least invasive, or the more aggressive injectables or the lasers that have a little bit of downtime. But it depends on what bothers you and how much time you have and what your goals are for your skin, but always skin first, because
Yeah.
to me, and especially lately, I think that's another 2025 trend. It's all about healthy skin. So
Yeah.
what can we do to make your skin healthy? Not necessarily what fillers we can inject.
That's what I was gonna ask.
know?
It's funny that you say, because that was gonna be the next thing that I was gonna talk about. Is like with going into 2025, I feel like what you just said is super
Yes.
true. Everyone that has those fillers, like the lip fillers, the Botox, all of
Yeah.
that, they're all getting it. They're getting rid of it.
Yeah.
And they're going into more of like getting just like regular facials, maintaining like the glow, stuff
Yep.
like that.
Yeah.
Have you seen that happen? I know that it's only January, but have you seen that happen in the
Yeah.
month of just January? A lot of the clients that you originally had that were doing more fillers and stuff, have they kind of backed out of it?
Yeah, it's been totally trending. And we always talk about that is part of our vision. I've always been that kind to promote quality of skin and healthy skin. To me, the aging process, as long as you have good looking skin, even if you have a few wrinkles, you're going to look more youthful than if you just had some injectable or some Botox done. So even though I do love my injectables and all of them, fillers, toxins, biostimulators, all of it, because they're so amazing, and thank God for that. But I am aware that what looks good may not be some injectable. You have the aging patient that is in their 40s and 50s. If they don't do something for the quality of their skin, like good facials at the esthetician level, good facials, like a good microneedling and some lasers, and they just do Botox and fillers, they're always going to look done.
Yeah,
and
you're not
getting
looking
away
like
from that
maintaining the
look
natural.
of being done, that's the current trend.
Yeah.
But that has always been our trend. And I think in terms of talking about transparency and what works for them, the truth is that, sure, you can walk out of my office with a little bit of lip filler and it's going to look great, but giving your skin quality, it's going to be better. It's a better investment for your skin. So
I think more and more people are looking for skin boosters, so how to boost the quality of the skin. So, and that's something that is growing more in United States because before it was like, not so much. Now you see it everywhere, and more people are asking for those kind of treatments.
Yeah.
Not just fillers and.
And when you
toxins.
say skin boosters, can you talk a little bit more about that treatment?
Okay, the skin boosters it could be there. We had different ones, but let's say you can do a skin booster with the hyaluronic acid that is more for hydration. We have one now that is it became popular because Kim Kardashian has got it done, and it's the
salmon.
Oh, the salmon skin.
The salmon sperm.
The
salmon sperm
Yeah.
DNA.
So it's a
PDRN.
DNA
I was
of
gonna
the
get that
salmon
done,
sperm.
but then I was like, I'm not trying to get like a red face and
Yeah.
reaction.
No, so but it's like it really, when you get it done, it's like you see the result
The
because
result.
you get a lot of glow.
Yeah.
The skin feels like tighter.
Yeah.
So they're looking for
Yeah.
those kind of treatments that they don't feel like we have patients. Your mom, she doesn't like to get
Yeah.
volume. She doesn't
Yeah.
like volume. She always like.
We just put her out there.
Sorry,
You
mom.
can cut her off, mom. She doesn't like volume. She doesn't. So
She's very natural.
Yeah.
She likes the more
she
natural
doesn't
things.
like, so it's a lot of people like they don't like volume. They just want to be natural, and they want equality. Of
Yeah.
the skin with quality, that it looks plump, that it looks nice, that it looks healthy.
Yeah.
Yeah, I remember I used to do, I did microneedling like 5 years ago. And I mean, salmon PDRN wasn't a thing. I just did it with the hyaluronic. But now when I do microneedling, I can't do it without stem cells or PDRN because it's like, to me, it's not the same at all. It's like once you do it, you can't go back.
Well,
Or-
wait until you start working with exosomes.
I was just going to say that.
Okay, go ahead.
No, you
Go ahead.
say
No,
it,
go
you
ahead.
say
Go ahead. It's something that is amazing because let's say that you do a frax that is a very invasive treatment. The one that we have is not that invasive, like it's CO2 laser, but you get very red. And if you apply exosomes right after, in less than 12 hours, your skin looks like nothing happened.
They're-
And also, it recovers better, but the treatment results are much better because you have the exosomes there.
How do you tell like the potency of like the salmon peter and the exosomes, like what you guys are getting?
So with exosomes in particularly, if they come sterile, so exosomes you can apply them like how Dr. Al was saying after an aggressive treatment. So you can do microneedling on the skin and then just put that stuff on top because it just needs a way of getting through the skin. You don't need to inject them, which is what's really nice, and that's why it works really well with microneedling. You can also do something like the AquaGold, the stamping. You can stamp the skin, create a channel for the product or whatever you're trying to get through, like the exosome, to go in, or topically after a laser. But those that you can microneedle, they're sterile. So they come in like a sterile ampoule with very specific instructions on how to mix because they are you have to keep them refrigerated.
And also the time, because let's say the one that we have, once you mix them, it have like 2-3 hours for you to use it. After that,
yes,
it goes to waste.
that it loses the effect of the growth factor that it's got. So remember, exosomes have literally 300 times more growth factor than our own PRP. So they're whatever PRP does for you, exosomes will do it.
That's what I've been
much more.
telling my clients lately. I'm like, PRP
good.
is, I mean, it's just your blood. So it's your
Correct.
body's doing what it already does. And when you microneedling, your body's going through the natural process of producing collagen. But all of these boosters are like literally like doing it like 10 times better, right?
Yeah.
also with the PRP, we don't think about it, but it's also it depends also how the lifestyle of the patient.
Correct.
Yeah.
Because the patient drinks a lot of alcohol, smoke, it doesn't hydrate. When you get the blood, the quality of that plasma is not the same as if you are a very healthy patient. You drink water. You you have your lifestyle is different.
Yeah.
So that one, they don't think about it, and they blame that the treatment doesn't work. But the treatment is great, but it also depends
on the
on
person's
this.
health.
Yeah.
Yeah. I did the PRP for the hair and
yeah.
it works so well.
Yeah.
And I'm like that. I'm thinking about it the other day. I was looking at my hair like in a picture when I had my ponytail up and I'm like, oh my gosh, it's happening again. So I have to come back and do it.
You can do that one touch up.
Yeah, that one touch up. Because I think I only did 2. So I missed
we
the
did
third
only
one.
2? Oh, yeah.
So
We gotta do
we'll
it,
get that
yeah.
one done. But it really works. So I can't even imagine on the face too.
So
Or with
there's more
stem
and more
cells.
studies on
Yeah.
on
Yeah.
exosomes and stems on
Yeah.
for hair growth. They're coming up with new
And
studies.
as far as like the internal, like the IVs, what do you recommend like for the skin? Like if I was someone coming to you and I wanted to get an IV, is there anything that I can do? Like, and do you see a big result with that? Or is that something more over time you see results
IV
with?
therapy, I always say that it's not it's complementary to everything else that you're doing, but it just depends on where you're at. Like if you're coming in and you have been really busy at work and you're dehydrated or you've been traveling, a lot of what you may see going on in the skin is because you're just dehydrated. You start to do like you do one IV and it'll immediately hydrate you. So that could be the issue. But then we can add things to the IV that can boost your immunity. Yes, there is a beauty cocktail.
A cocktail.
Mm-hmm.
No, and also we were talking before we started like about the glutathione, and the glutathione is the
Yes.
master antioxidant. So if you can get it in an IV, because everything that you get in an IV is they're high doses, but also your body absorbs the whole thing. So it's not like you're gonna absorb 30%, or the body's absorbing everything.
Is that something you should do weekly or monthly?
Well, the IV therapy normally, I mean, the protocol, the way it should be is like you can get once weekly for a month, and then you space it out to once a month.
Okay. So kind of
So
like
that's the way.
acupuncture, like you start off doing
Yeah.
more and then you have more like maintenance.
Not everybody starts like that. Some patients, what they do is they get once a month, and that's it, and it works for them.
Okay.
So
Or,
everybody
whenever,
also,
they need a boost, or
Yeah, that's like
whenever
me.
traveling.
Whenever I'm traveling, I get
It's
one.
not
Or
a
if you've
must.
been sick and
Sick.
you
The way
need to
it
recover,
works.
Yeah. When you're sick, that's a really good one to
Yeah.
do. And then when it comes to, for example, like IVs, B12 shots, you guys offer all of that as well. Are there other things that you guys offer in that genre? Or is it just IVs and B12 shots?
We do IVs, we do all the acupuncture and everything that.
well, with
that we
I
for-
do something that is called acu-injection.
Mm-hmm.
In her medicine, it's called prolotherapy.
Okay.
So they go into the joints, especially when you have joint pains, they go into the joints and they inject different substances there. In my case, what I do is I don't go into the joint. I do acupuncture points, but I boost the acupuncture point with homeopathic medicine or vitamins. So I inject it more superficial, but the results are great because
And we
it
can
helps with the
also add
inflammation.
PRP.
It can also you can add also PRP there.
Wow, so there's a lot of things that can be mixed.
Yeah.
Like you said, beauty cocktails.
Yeah.
Exactly.
I love
You
that
can-
word.
You can mix those things and you inject it. So you don't have to
Yeah.
inject 10 times the patient because you have B12, you have PRP, you have vitamin C. No, you can just mix it and just inject it in the
Okay.
places. But the big difference between conventional medicine and TCM or traditional Chinese medicine is like they go into the joint and we don't. So we are not supposed to go there. So what we do is we inject the acupuncture points, and they boost the energy and of the body through that point, and it helps with the inflammation, with the pain, so all that.
Okay. And if there's estheticians, for example, that are interested in kind of going the same path that you guys are in now with all this knowledge and education that you guys have, what would you recommend for them to do?
As an esthetician, I think, well, if you want to do the injectables and go that route, becoming first a nurse and then a nurse practitioner would be great. But honestly, even to start practicing and using the laser devices, getting the electrolysis certification is a good start as an esthetician. That gives you the ability to do hair removal and radio frequency and things that you don't necessarily have to be a nurse or a nurse practitioner to do. So I think that's probably a good idea to transition there.
Okay.
And you? I'm like fascinated by acupuncture. Like you're talking, and because I've been getting acupuncture done like this whole year, and it's so amazing. But I also am like, I don't know how it works, you know?
Well, the thing is, look, my first encounter with acupuncture was when I was 18 years old, back in Cuba. And it was because my mom and I suffered from sinusitis, really bad. There was, in Cuba, actually, medical doctors are the ones that perform acupuncture. We don't have acupuncturists in Cuba. It's the medical doctor. So I got a friend that told me, I have a doctor that he does acupuncture for that. So I told my mom, and my mom said, you know what? I don't believe in that. I don't want to go. I said, well, I'm going to try it, you know? So I went there, and I don't remember exactly how many sessions I got. I got rid of sinusitis. Never got it before, right after that. My mom, on the other hand, she never got rid of sinusitis, and she got 3 surgeries, which I thought was horrible because really, every time that she got one of those surgeries, it was like nasty. She never got rid of sinusitis. So for me, it was something that I said, oh my God, this is something that I would like to try. You know, when I came to the United States, I couldn't pay a medical school, even though I wanted it, but I couldn't. So the acupuncture school was more affordable for me, and it's something that I like it. You know, going through it, I said, this is really what I was meant to be, no a medical doctor, for some reason.
What do you believe
Yeah.
in?
Yeah.
You know?
And again, I'm not against conventional medicine. I think if we can work together,
Yeah.
it will be amazing
so
because let's say I always put this example how we can work together, you know, like the two medicines, facial paralysis. I see great results when a person has a facial paralysis, and after they start doing acupuncture right after, they recover very fast. When the patient go through the conventional medicine only, and they do all the treatments that they do, all the rehab that they done, they do, is like they take longer, and it's not that it's not working. It's just like sometimes they have only like 10 sessions, and maybe they need 20. Everybody's different. But if you mix both of them, the recovery is really, really fast. You can see how the face goes back in place, and they start seeing, results earlier than if they do it just in one way.
I think it's getting more recognition, obviously, but I hope on like a wide spread in the United States because
I think more people are looking for those treatments now. I think in the future maybe we're going to see it. Actually, we have cancer centers that they use acupuncture for relax the patient for after chemo, treatment. because after they get the chemos, they get really sick, and acupuncture help with the nausea.
Mm.
So, and it's funny, nobody think about it, but when you go in a boat, you get a bracelet that have a point here. This is an acupuncture point for nausea, and that's why we sell those bracelets in Walgreens. But now nobody tells you that it's pressing the point.
Wow.
Yeah.
Fun fact.
Fun fact.
Yeah.
Yeah.
Okay,
I
so
love
I do want to just move on to the next topic, which are the ICS trade shows. So for those of you, it was in 2023, right? In 2023, Al actually spoke at the Miami conference. How was that?
Okay. Every time that I'm in front of a camera, I get like, oh. It was fun. Yeah, I got actually a lot of people that were there responding. Like they say it was amazing. Because I talk about cryotherapy and the machine that I told you at the beginning that we have. It was something new. I never did something like that before. But I loved it. It was really great, and I think, if I need to do it again, I will do it again. Even though it's like,
If you need
but
to
I
do it,
recommend it. I recommend
need to do it
it.
again.
Yeah, because I was like, do you want to go? Okay, I want to go. No, it wasn't like that.
But he
no,
did
it
get a
was-
lot
it
of
was-
good feedback.
Yeah,
He
I
did.
got it.
I think
very
you
good
did
feedback.
great.
Yeah, and you, Vienna, as someone who has also come to the shows, what advice could you give the attendees? You becoming like you as a nurse practitioner, because there's a lot of estheticians nowadays that are becoming nurse practitioners.
Yeah.
What advice can you give them for going to these shows? Like you as someone who has done it before.
I think it's extremely important to go to these shows, honestly, because again, going back to the skin, you have to learn the skin. You have to understand. You have to realize that becoming a nurse practitioner or the medical aesthetics world, it's not just about injecting, not to downplay our skills and what we can do, but honestly, once we're trained in medical aesthetics and we learn how to inject a lip, a lot of people can do that, But learning about the skin, learning how to take care of skin, different skin types. As an esthetician, you get to learn, for example, the Fitzpatrick skin types, from the lighter tones to the darker tones. That is extremely important when you're starting to do lasers and when you're doing lasers on patients to make sure you don't burn someone,
There's lots of cases of that, right? Burnings.
Yeah, there's and that's why it's always good to know the technology so you know what device you're using, but you first, at the end of the day, you have to know skin to know the intensity and the the gauging of the heat of the laser, for example, for that skin type.
Yeah.
And also I think it's really important to know about all the products out there.
Yeah.
I mean, there's so many products out there that we need to know, even if we don't have them in the office. It's literally like our weekly homework to find out about if SkinCeuticals came out with something new or whatever creams people are liking. And, the patients would tell us, oh, do you carry this in the office because we love this product? So by going to the shows, you learn about what products are innovative, what's coming out, what people are talking about.
A lot
what's
of new
popular,
technology.
New technology. So I think that is like the foundation of starting to grow and become a nurse practitioner. Is the foundation is always skin first.
Skin first. Skin first. Yeah, so for those of you who don't know, we have our Philly show that's coming up on May 4th and 5th. And then we have our Dallas show that's coming up on May 18th and 19th. And as Vienna was just saying, with these shows, we do offer a lot of education. And the education is all complimentary to your admission. So you can definitely go to these shows and show up to these classes and get that education that you need. Also, the live demos on the floor, so you get to test the machines like you were just saying, touch the machine, see what it does, try it onto your skin. So yeah, Sam, do you want to talk a little bit more about that?
That's been like really one of our goals, is that we try and have classes like conferences and brands that kind of cater to every type of esthetician. So those who are more into the holistic, those who are more into like the medical, want to be more like medical estheticians. But I think it's really cool if you guys kind of open your minds and learn a little bit about everything. Because if you can fuse those two together, like I think it sets you apart from your competition big time.
Yeah, and every year, every year is like basically like a new chapter, and there's new products that come out and new technologies that come out. So coming to these shows gives you that opportunity to kind of explore.
Yeah.
So
Yeah, in South Florida, it's like that. So the fact that we combine both, the holistic and the medical, for example, that's our niche.
Mhm.
And we know skin really well, and we know our lasers really well, and we
Mhm.
love our devices. But getting the education is important because
Yeah.
you need a way to stand out, to find out what you really like and go for that and stick to that and have that be your talent,
Mhm.
so that you stand out next to your
Yeah.
other colleague esthetician who may have a different forte than you know.
Mhm.
So it's important to get that education.
And if there's anyone who's interested in coming to your spa to get these services done, where can they find some information to come see you?
Oh, we have the website, which is relaxspa.us. And also we have the Instagram account for her and for me. I mean, we've got two Instagram accounts. One that
Relax
is
Spa
for the
is
office,
the popular one.
Relax Meg Spa, and Skin by B. So everything is there. We post everything, like daily, the new treatments, what we're doing. You're gonna get a little bit of everything because I actually met with a marketing guy once, and he told me you shouldn't be posting any trip that you take. And I'm posting everything because my patients like to see where I am. It's like, or what I eat. Or
That's
what
your
I drink.
your side hustle right now. Your
Right.
travel.
Yeah, his
Yeah.
travel
So
blog.
it's
traveling
like,
traveling by Al.
It has been working for me since the beginning. And actually, at the beginning, I was very active with Instagram, that I was posting at least 3 times a day, and everybody was saying,
Oh,
you're
wow.
oversaturating but it did work out for me because we got so many
Yeah.
patients from Instagram that
Yeah.
you won't believe it.
Whenever we do a video, everyone loves it.
Yeah.
And
So-
Yeah, because you guys do a good job.
So,
well,
Yeah, yeah.
we get camera shy and it's
Mhm.
hard.
No, but you guys are adorable. That's why.
no, thank you.
Adorable Al over there.
Well,
We
we'll
love
make sure
him.
to include like your Instagram, your website, everything
Thank
in
you.
the show notes.
thank
Yeah.
you.
Yeah.
Well, thank you guys so
No,
much for coming.
Thank you for
This
having
was
us.
fun.
Yeah.
It was fun, yeah. I got the little. I
You got to
relaxed.
breathe.
I
You relaxed.
relaxed, yeah.
You did really good.
Thank you.
Bye, guys.